I'm going to give you a quick overview on Elite Field. This is the system that we are using on our tablets to enter our runs in. This probably looks familiar to you. We did go over this probably almost 6 months ago in our squad meetings. So hopefully this is just a refresher for you. I'm not going to touch on everything. If you have questions, please reach out to me and I can hopefully answer them for you as quickly as possible. Anyway, let's go ahead and get started. So when you click on the Elite Field icon, it's going to open up and into a new web browser. And this is what it's going to look like. It's going to ask you to sign in. So this does not actually require internet, which is nice because we're not always close to Wi-Fi, or maybe we don't have the hotspot when we go into somebody's house. Basically, it's going to save your information. And when you get back to Wi-Fi or to hotspot in your rig, it is going to just upload. So you're not going to lose information. It's going to stay all right here. Okay, so we're going to go ahead and log in. I'm going to send you a login username and password. The password will be generic and it will have you reset it once you log in. So I do highly suggest that you stop in the garage, go into the rig and open the tablet and go ahead and log in with your username and your password that I give you before you actually go on a run. Just so if you have any issues, any questions, you can give me a call and I can try to help you out. We really don't want this being done on home computers because it does deal with people's information. So we just really want it to stay on the tablet. So I know it's not really convenient for you, but if you could just, when you're on a run and maybe you're with somebody else, go ahead and put your information in and update your password. That way you have it. So we're going to go ahead and sign in. And like I said, I am going to make this pretty quick. I'm just going to go over some points and show you how to post these. If I have questions or issues with them, I can actually just send it back to you, and I'll probably send you a text message or give you a phone call and let you know that I need you to fill out some more information. And I'll show you how that all works too. So when you log in, you're going to see it says my name or your name, hopefully down here. You're going to have your inbox settings, log out. When I contact you, it's going to come to your inbox. We'll talk about that last. We're going to go ahead and click on new incident. This is what it's going to look like. When you first go on a run, you're going to have all this information. You see all the red. We're going to go ahead and start with the EMS response number. This is something that Elite will not let us take off. So we do have to put not applicable because Tri-County does not require this at this time. So we are not doing an EMS response number. For an incident number, this is going to be the number that dispatch gives you. So Marshall County does it different than Kittson. Marshall does 20201111, whatever, something like that. If you're in Marshall, we're going to go ahead and actually take off the first 20 just because they actually started doing this halfway through the year. So the way that I have our incident numbers is not matching. And when we go ahead and pull up reports, it's going to look really weird because they actually implemented this new system like halfway through. So we are going to enter our runs just to be 200. So we're going to drop off, if you're in Marshall, the first 20. I know that. So if I have to call Marshall for something, I know that to add that 20 back in. Okay, so we're just going to go ahead and put in an incident number. Okay, and it's just as simple as clicking next. You're just going to find a complaint, whatever you were dispatched out for. This is most of the time going to be no. We don't have dispatch that actually gives us instructions. They are just dispatch. They are not emergency dispatch. So they're just going to give us the address and what we're going to. So we're going to put no for that. If there's any delay within dispatch, if they tell you that there was a delay, then you can go ahead and put that in here. Okay. Next, it's always going to be 911 response. If there is any delay to the scene, you want to go ahead and put this in here. Okay, so whether you got lost, let's say that you were waiting for scene safety, you had to wait for law enforcement, that's going to go here. And if you start typing in, so it's going to come up with like scene safety, not secure for EMS. If you don't want to type in, you want the options, you can just click this on the side right here. It is going to come up with what options it gives you. So for right now, we're going to go no delay. We're going to go ahead and put in what ambulance you're in. So we're just going to say that we're a Newfoundland's ambulance, E6. We're always going to be a BLS, ground transport. We're going to want to put, if you have two people and you're both EMTs, you're going to want to put it EMT, EMT. If you're running with an EMR, you want to make sure you put EMR, EMT. This is basically just for reporting purposes. I know that a lot of times we run with more than two people, which is fine. Basically, if there's an EMR on board, you maybe just want to do EMR, EMT. It's not a big deal. Like I said, more for reporting purposes in the office side. Okay, so if we were the first unit on scene, this will maybe be different if we did mutual aid for somebody, or let's say that Middle River is helping Newfoundland or Newfoundland is helping Middle River. And, you know, one of those services is on, you know, whatever, Middle River's on scene first or Newfoundland's on scene first and then Middle River comes. It really, you're going to want to put yes or no here, okay? For other agencies on scene, you're going to see we automatically have Newfoundland first responders down here. So if they came to assist Carlstead or Middle River, you can go ahead and put them in. Let's say that law enforcement was called. Then you're going to want to put law enforcement. You can put in Marshall County, you know, law enforcement, whatever. We're not going to put anything in right now, but you get the gist of it. So you can put in anybody that's coming. Again, if you want to see what options there are, you can definitely, you know, choose from one of these. Okay, so we're going to put okay here. This is the location address. So you actually can put this in right away when we get that from dispatch. So we're going to just, it gives us assisted living, hotel, all of these. So let's say we're just going to a house. You can put home in here, and it's going to give mobile home, single family home. Most of the time that's what it's going to be, you know, apartment, that's all in there. Like I said, you can click the side, see all the options if you don't know what to choose. So we're just going to say, okay. And for right now, I'm just going to put in Carlstead, and it is going to remember some of these once we start entering. If you are on the Wi-Fi or hotspot, it will actually pull up and try to, you know, remember some of what you put in before. So I'm just going to put this in, and the postal code lookup might not work if you aren't on Wi-Fi. If you put the postal code in and you're not you don't have an internet connection, it will upload once you get back to the internet. So just go ahead and put your postal code and go ahead. So we're going to click next. This is where you can put in your crew members. I'm just going to go ahead and put my name in here. If the level isn't specified, you can go ahead and put that in. Crew member roles, your driver, you're going to want to put those there. You know, if you're the primary patient caregiver at scene, you're going to put that in. You know, the other listed here, let's say we have people helping load. So let's say I show up on scene and I'm just there to help load the patient, to help on scene. You know, it's nice to have those names on the report so we know. You can go ahead and put other, or you can even put other patient caregiver just at the scene. Whatever, you know, I would maybe go into that a little bit in your narrative and just say, you know, Ashley was on scene and helped us load the patient, just so I know. And when you put other, it's not unspecified. At least we have some kind of context. Okay, so we're going to go ahead and leave that. This is something new that they've actually added. So with the COVID era that we're in right now, PPE used, they're trying to make it so we can just print reports out. It is a little hard because it is just kind of impossible to track on what we're using because we're going to forget to add something. But if you want to add it, it's going to say, what did you use? So let's say we just did the standard eye protection, gloves, N95, maybe put our surgical over that. Okay, you can choose those. A level B suit is going to be basically what we show up in when we know it's COVID. So your gown, your mask, your goggles, all of that, your face shield, that's going to be your level B suit. Okay, your level D is going to be actual like hazmat suit. So if you were to go to some kind of, you know, train accident or something, and there was like some, you know, hazardous material and you had to put a hazmat suit on, you would choose that. Okay, so we're going to go ahead and push OK. This is something new as well. So this is suspected EMS work-related exposure. So let's say we go to a scene. This actually has happened to us a few times in just the last few weeks, where we maybe didn't know that these people had COVID, and we hauled them to the hospital, and we found out maybe through the grapevine later that that they're possibly, or they have the symptoms of COVID, and you don't know if you were exposed. You can definitely click yes right here, and I will check into this. I'll maybe contact you and say, hey, you put yes for, work-related exposure. Is this, did you come into contact with something? I'm going to question you, and then I'm going to follow up with the hospital, which we know the hospitals are having trouble getting back to us. So I'm working on that. It's just a way to notify us and also to document it in the report. So if you do think that you've been exposed to COVID, I would highly suggest you put yes here, and I'm more than likely going to text you or contact you. If you were to ever get injured on a scene, you want to put yes here. We're documenting that. Okay. So we're going to go ahead and we're going to put no for now. All right. And this is just the crew members. So they give you more options. We don't have to do this. If you think you have too many boxes, you can always delete one. It's not the end of the world. Okay. So we're always going to be emergent. We actually do not normally do transports from the hospital. So when we get called out by dispatch, we are called as, an emergency response. So we're going to put emergent. There is sometimes that maybe the patient asks us not to come in with lights and sirens. We can definitely put no lights and sirens. Or, you can put initial lights and sirens, but then we downgraded to no lights and sirens. You have all those options just like on the run sheets. Okay, so number of patients, you can choose multiple here if you have a car accident or something like that. We can go into this in the future. Maybe I'll do some more of these just to show you what other options there are, because it's actually, you can pull up more than one run report at the same time and flip through them. And maybe that's something that we could, like I said, do in the future, and I can show some tips and tricks on how to use Elite Field. But right now we can do single. And I think in the field, the easiest way to do this right now is just, even if you're in a car accident, you can still put multiple, but I would actually do your other people that are patients on a run report, which we will keep in the ambulance. And then when you get back to the garage, you can just go ahead and enter them in on Elite. Okay, that's probably the easiest way to do it right now until we all just get familiar with this. So for the most part, hopefully we're going to be treating and transporting this patient. So we're going to want to choose that. As you see, this all turns red. We need all this information now. Let's say that we do cancel. You can see that it's not going to need the patient assessment, the transport, the narrative. You still want to write a little narrative, however, even though it doesn't make it red, I still will require a narrative. So if you don't write one, if we were canceled, I'm probably going to email you and tell you need to go in and fix it. So you will still be required to write a narrative, but it does show that we need signatures and the supplemental questions. So, but we're going to go ahead, like I said, you can find just about anything on here. Patient refused, against medical advice, you can put that in here. If you told the patient to go in, but they still refuse, definitely put that. And then it's going to say that we assess the patient. We're billing for that now. So you want to make sure that you put the patient assessment in. And like I said, we can kind of go through some of these little steps. I just want to do a quick overview. So we're going to go ahead and do that we transported the patient. And if you do have multiple, this is where you can put green if they have minor injuries, yellow, the different things like that. Okay, and if there was any kind of scene delay, so if there was an accident and they had to get extricated, you can definitely put that in here. If there was a hazmat issue, the distance, let's say that the accident was out in the field and you had to walk across the ditch in the field to get to them, you're gonna want to put distance, okay? Like I said, you can go ahead and just click, it's all gonna show up on the side. So, and here again is other agencies on scene. You can see earlier we put Newfoundland first responders and law enforcement were on scene. Right now you can add to that if there is mutual aid coming. Go ahead and add to agencies on scene. Okay. Patient complaints. This is what we're going to put. So we're just going to put the chief complaint. This is if you have a secondary. We're just going to put weakness. Okay. Let's say that they've been weak for a day. and just click OK. So secondary, if that was theirs, you can click add, and then we're going to put secondary. We're going to say they had a fever, and that's been for 1 day as well. Okay. You do not, if you have a chief complaint and you spilled it out right there, you don't have to have a secondary. This is just a place where you can type what they're telling you. They are two completely different things. Go ahead and put a chief and a secondary. Not a big deal. Okay, so it's then going to ask you where the location of the complaint is. So for ours, we're going to put just general, global, and next. Okay, so this is where you're going to put the primary impression, what you see when you show up on scene, just like you would on your run report. You see now we have it updated. You can put COVID in here. There is just a lot. So if you, let's say that, again, we put weakness, that comes up. So I started typing weakness, fever, that also comes up. If what you're seeing doesn't, if what you are seeing when you arrive on scene doesn't come up, go ahead and, like I said, click the sidebar. It's going to come up with everything that you're able to put in, okay? It's going to ask when the symptoms started. So let's say that this person, their symptoms started yesterday at maybe 1 o'clock in the afternoon, okay? If it is today at that time, you can just click the little clock, and that's going to actually put in the time. All right, so primary symptom. Okay, so this is the symptom that they are showing. So we're going to put weakness again and fever. Okay, if they are a lower level, we don't think that it needs to be a load and go. We can actually sit on scene for a minute or two and take a, get all our information. You can put lower. If this is emergent and we need to definitely load and go, we're going to put emergent. If this is, cardiac arrest, we're going to put red. And there is also the option to put dead without resuscitation. You pretty much, it's like, again, this isn't a huge deal. Put what you think. If something changes, we can always change it on my end too. Okay, so if there's any alcohol or anything that you see on scene, you can go ahead and put that there. This is for the assessment. I'm just going to show you this. So you can put, you're always going to normally assess your patient. So you want to make sure you put this in. It's quick. Go ahead, and if you're doing it today, right now, you're going to put the time in, mental status, skin, head, face, all of that. It goes quick. Go ahead and put that in. Vitals. Again, you can just click the clock. You can change this time over here if it's different. So let's say we did it at 15. There we go. We'll just change that. If you do an EKG, you're gonna put that in here. It's gonna ask, how many leads did you use? If you are unsure of anything in here, you don't have to click it. It's not the end of the world. If something shows up, I'll ask you a question if I need it clarified. Okay, you're gonna want to make sure you put blood pressure in here. It's always going to ask you for if you did it manually or automatic, which is our MRX. You can just click that. Your level of consciousness, heart rate. Okay, let's see here. Okay, so your pulse oximetry. And if they're on any oxygen at the time of your pulse oximetry, so if you want to put low concentration, at room air, whatever. All right, respiratory rate, effort. You're going to see they have labored, rapid, slow, shallow, just about anything you can think of is in here. All right, and you're going to see if we do put in certain things that you are going to have the exclamation points that come out. So like the blood glucose level, if you put in stroke, it's more than likely going to ask you to put in a blood glucose. So which is kind of nice, because if you're saying they have an altered mental status, it automatically is also going to ask for a blood glucose level. So it kind of reminds you like, hey, you should probably check for this. You know, of course, if you don't do this till you get back at the garage and you're just doing it on paper, this isn't going to help you. But when we get faster at this and we're using them actively in the rig, it is going to say, hey, check blood glucose, you know, so that's kind of nice. So this one tells me that I should check it. So let's say we did and it was 100. This is your Glasgow Coma score. You always have to do this with every one. If they haven't changed, you know, put the last, you know, what you observed in the last one. You always want to put initial GCS is legitimate. If something happens, let's say that they go downhill and let's say ALS jumps in with us and they intubate them, then we're going to have a different one. You can choose something different. So, you know, like I said, mostly it's going to be this one that you're going to choose. Temperature, pain scale. Like I said, depending on what you choose, it's going to say, hey, you should check this. So it's telling me that I should probably check the stroke scale. Probably because of the weakness that I put. So we're going to say, it's going to ask you which one. So all of that, we're going to cancel that out. Procedures, this is when you do blood glucose checks, when you put on defibrillator pads, when you use the AED, when it advises a shock. This is where you're going to put that information. Once we get everything hooked up, you know, if it's the MRX or if we get different, you know, patient monitoring, hopefully it will just automatically feed into this. So if there is a shock advised, it will automatically put that in and we'll know that we did it. So for right now, you have to put it in yourself. So if that's just a time you write down on a piece of paper and you do this later, that's fine. But we do need to make sure that if we are doing a procedure, we're putting it in here and that we're charging for it. Okay. Airway, if you were to put in an oral airway or you know, anything like that, you want to go ahead and put that information in. Okay, and medications, so oxygen, albuterol, nitroglycerin, you're going to put all that in, okay? It also is going to ask the dosage, how it was given, if they had a response to it, you know, if there was any complications, you want to go ahead and fill that out. And I'm also going to point out in procedures that CPR is actually part of that as well. So if you're doing manual CPR and then you put on the Lucas later and are doing CPR by Lucas, both of those are going to be different. So you're going to want to put manual CPR and then at a certain time. And then when you put the Lucas on, you're going to want to put that in the procedures as well. All right, so we're going to go ahead and go to patient information. I'm actually just going to skip through this. This is pretty simple. Name, birth date, age, you know, all the information that we normally get from a patient is going to go here. The nice thing is this is actually going to remember. So in the future, if let's say we get in the rig and we're on hotspot or something, it is going to pull up any history, medications, allergies. We're not going to have to remember all these. Or if you pull this up in the garage before you leave really quick and you dispatch or active 911 gives you the information, you can go ahead and pull that patient up and it's going to tell you, you know, maybe we've had issues with domestic abuse there, or maybe we've had drug issues at that house. So definitely something when you jump in the rig right away, grab the tablet, pull the information up at the address. We can put information in. If you need information put in on the patient, you know, please send a note, email me, text me, and I can put information in on the patient as well. Okay, so phone numbers. You're going to go ahead and put in the address. Let's say the address is the same where they're living. You can just simply click same as incident address. This is where they're going to ask for medications. And the nice part about this is that the medications are in here. So if they tell you they're on albuterol, you don't have to sit and wonder, or Xanax, you don't have to sit and try to figure out Google, am I spelling this correctly? It's going to put it right in here for you. So you can just go ahead and, you know, type something in and it's going to come up. So like aspirin, whatever. If they have allergies, all of that is right here. So if you went to an allergic reaction for a bee sting and let's say they tell you they're allergic to bees, you're going to want to go ahead and put that in. Do they have any medication allergies? Again, the medication just comes up. It makes it so easy for us. Past medical history, you can put that right here. So transport, how many patients? One. we're treating and transporting. If we go ahead and we ask for an intercept, it lets you put FM ambulance in here, and the time that ALS was called, the time that they arrived. Then when you get to the hospital, it's going to ask, how did they get on, or I'm sorry, when you get on scene, they're going to ask you, you know, did you take them in a stair chair to the cot? How did that work? So you're going to want to put stair chair to cot, and then when, how they were sitting, if they were laying, if they were in a semi-upright position. How are they transported out of the ambulance? Most of the time it's going to be by our by our stretcher. And then it's going to ask again the transport mode from scene. Was it emergent? Was it downgraded? Again, we're always going to be ground ambulance. Unless, of course, on the scene that we called for air, then you're going to want to go ahead and put that in here, okay? Was there any delays during the transport? So let's say that we had something break down or something happened during transport, you can put that information in here. Okay, so this is now we're in the narrative. So the nice part about the narrative is that you can generate a narrative, and we are going to allow that. However, I do want you to type in some of your own information, because it actually is not going to give us everything that we need. So if I generate just a medical abstract, it's going to put in this information, and I'm fine. You can take in and out of what you want. You know, the patient was this old, chief complaint of weakness, lasted for 1 day. You can leave all that in. But now I need you to put in here what exactly happened in the ambulance. So it is going to put when you did the AED or when you started CPR. When you documented that previously, it's going to put it in your narrative, okay? But I do want you to make this your own. I want you to type exactly what happened, but this does help to make it just more complete and help you a little bit to guide you on the narrative. You have a few to choose from. I mean, the medical abstract is really good. You know, if you want to go by, you know, how it all went, you know, the time, you can do it like this. If you like the chart narrative or the SOAP narrative, you know, I'm pretty indifferent as long as you're putting in your own words as well. Okay, we do not touch the billing info, so you can just skip over this tab completely. I know that there are some exclamation points here. Don't worry about it. This is actually for our billing company. They're the ones who actually take care of that. Signature, you are going to want signatures. So you're just going to add a signature. You are the EMS provider, and you are the EMS crew member. So you can go ahead and just put your signature in here, and it's going to ask you for your first name and last name and the time. You can just click that timestamp right there and push OK. You're also going to want to add the receiving facility in, and it's going to bring up nurse right away. That's who normally signs them. So let's say your nurse signs it. You know, definitely ask them for their first and last name, which we should be getting anyway. I know it's hard because the hospitals have been so busy lately. You know, hey, what's your first name? What's your last name? You type it in real quick. Signature. If you don't get their first and last name, I mean, there's times that we don't. It's not the end of the world. We had it signed. We have a timestamp. Okay, so the supplemental questions. These are questions that we are asking to make sure, does a resident reside within the township that is a member of Tri-County EMS? So if you pick them up in our PSA and they live, their actual household is in our PSA, you're going to put yes. If they were in a car accident or they were staying at somebody's house and they got into an accident, you're going to want to put no. If they don't live in one of our townships that pays membership to us, they are not going to get a discount. So, I mean, this is kind of important because their bill is going to be different if you put yes or no. Most of the people that we pick up, you know, that I've encountered when I've entered runs in is yes. But like I said, there is, I've actually done a few that are no. So you are going to want to just make sure that if they don't live in the township, to put no there. Make sure you put your mileage in and your signatures. Okay, so this is for times. Like I said, you can just go ahead and put your times in here. Not a big deal at all. Whatever dispatch gives you, if you can remember to